Hi everyone, it's Adrian from Living Holistic Health here. Today I want to talk to you a little bit about multiple sclerosis and some alternatives to help with treatment options. There are lots of people who suffer from MS, unfortunately, in our community. And if you're not familiar with MS, it's a disease which affects the central nervous system, specifically the coating of the nerve cells around our central nervous system. These things called myelin sheaths, and causes them to, the body attacks itself and causes them quite a few problems with their brains and central nervous system, which can influence lots of movement and bodily functions and things, eyesight as well. Now, lots of people, as I said, lots of people are looking for alternatives with the MS, and today I'm going to talk to you about 4 specific diets that have been shown to help improve MS symptoms, okay? Now, the first one goes back to the 1950s, and it was created by this guy called Dr. Swank. That's Dr. Swank. He had some people enrolled in this trial, 144 people I think it was, in Canada back in 1950. And what he did was he actually analysed the types of foods that these people were eating, and he prescribed a certain type of diet, which is now what we call the Swank diet. And the gist of it is basically that these MS patients followed a very, very low saturated fat diet. Okay, so saturated fats are things like butter and those fats that are very, very common in our diets and in our foods. Very, very high in what's called pro-inflammatory markers or mediators. And what he did was he actually reduced the amount of saturated fat in the diet and basically got these people to eat a low saturated fat, a low fat diet. No red meat was allowed pretty much for the first year, and only eat 1 meal a week after that. So it was basically just fish and for protein, fish and chicken and white meat, as well as lots and lots of fruits and vegetables. Nuts and seeds were encouraged, etc. But very, very low in saturated fat. That was his focus. And the reason for that is because, as I said before, if you have a higher proportion of saturated fat in your diet, you're going to have a higher proportion of what we call pro-inflammation. And the whole idea of his diet was to reduce the amount of inflammation through food. And he wanted to see if that had an effect on symptoms. And what he found with this trial, it continued on, and a lot of his patients are still alive today. Fortunately, he's not, but a lot of his patients are still alive today. And what he found was that it had a marked effect on their symptoms and actually improved their lives just by following this low saturated fat diet. So that was very, very popular, the Swank diet. You can get some more information, just Google swank.org for MS and you can find some more information there, or have a look at our website. We've got a list of all of these things for you as well. So that's one dietary approach. The second dietary approach was invented, or not invented, but it was talked about by Dr. Terry Walls. So she's a medical doctor over in the United States. And she was actually an MS sufferer, and she got to the point where her MS was so bad that she was actually in a wheelchair. And she was searching through the medical literature for answers apart from just drugs to help with her MS, because the drugs weren't necessarily helping her a lot. She was getting progressively worse. And what she found when she actually looked in the medical literature and looked for alternatives to what she could do, she found a lot of information on nutrients and food. And so what she did was she started looking at nutrients and food to include specifically for brain health. And then she invented what she's called the Walls Protocol, and you can have a look on her website, Terry Walls. She's got her books there, and she sells those, and she explains how the protocol came about. But basically, the gist of her dietary regime is pretty much she advocates what's called a Paleo style diet. So you might have heard of the Paleo style diet before. It's something that was invented or is proposed by a lot of people, including Pete Evans, famously in Australia, to talk about the food that we ate prior to the invention of agriculture, pretty much. So basically, when we lived a more nomadic lifestyle, so grains aren't allowed, legumes aren't allowed, all those processed refined carbohydrates are not in there. It's basically just meat, fruit and vegetables, and some nuts and seeds. So it's a pretty clean diet, low in those refined carbohydrates and low in the processed foods. And so Terry Walls has based her protocol around that, with exercise and a few other things, and a lot of people have got improvement. She certainly did. There's a photo on her website where she was in the wheelchair, and a couple of years later she's back on her on her bike, actually riding around. So she's certainly a great example of this diet working. But it's a little bit different to the Swank diet in that it doesn't concentrate so much on controlling the amount of saturated fat. So it's a little bit different. That's the Walls Protocol. The third type of diet is being proposed by Professor George Jelinek, and he's from Melbourne, and he's a medical doctor, and he, again, is like Terry, is an MS sufferer. And what he did was similar to Terry, Dr. Walls. He looked at the medical research when he was given his diagnosis of MS, and he searched for things other than just drug therapy, ways that he could possibly assist with his multiple sclerosis. And what he found was that there's actually quite a lot of information out there similar to Dr. Walls, and he dived right into the swank diet in particular and really focused on that. And he's got this program and website called up and running called Overcoming Multiple Sclerosis. That's OMS, and he talks a lot about his protocol and his method that he uses to help people around the world. And his sort of diet is very much based on the swank diet, but it also emphasises the importance of taking omega-3s and vitamin D as well. So it includes exercise, etc., but very much again low on the saturated fat. No red meats and no land-based animals allowed in terms of the food that we're eating. Very much concentrating on in terms of fat content, just with omega-3s. So from fish, from the seafood sources, and from nuts and seeds, so your walnuts, etc. will have the omega-3s in there. So that's what the Overcoming Multiple Sclerosis, OMS, Professor George Jelnick, his diet's based on that. And again, that's had some great results, and that's helped a lot of people. You have to just look at the testimonials on the website or his Facebook page. A lot of great results there for people. And lastly, the ketogenic diet. Now, you might have heard of a ketogenic diet before. A ketogenic diet is basically a type of diet that restricts the amount of refined carbohydrates that are in your diet so that your body switches from burning sugar for energy and actually promotes burning fat. So you use fat for fuel, your body fat, and the fat that you eat gives you your energy rather than carbohydrates, which is your normal body source of energy. And so the body produces ketones and your body runs off these ketones, and that's how you get around. Now, a ketogenic style diet, it's been shown in multiple sclerosis, and the theory is that multiple sclerosis is an autoimmune condition, but in addition to it being an autoimmune condition, it's also what's called a neurodegenerative disorder, i.e. it's not just the body attacking itself, that's what autoimmune is, but what it's also talking about is the fact that the nerve fibres, those myelin sheaths that I talked about before, they actually degrade and break down as well as just the autoimmune component. So that's where the ketogenic diet has been found to be really effective at stopping that neurodegeneration from happening, and it does that by supporting a specific type of part of our cells called mitochondria, which are the powerhouses of our body. And using ketogenic diet, what you can actually do is you can stop that neurodegeneration from happening or slow it right down and promote a more anti-inflammatory response in the body. So there's a few caveats with a ketogenic diet. You have to make sure it's well controlled and well supervised, because a low carbohydrate diet will actually mean that you could go into what's called ketoacidosis if you go too fast into it, and that's not a very good thing. You want it to remain nice and safe and effective and healthy, and you should get some professional advice if you want to follow that type of diet. It's used a lot for epileptics and epilepsy, so it does have a lot of good research on it there, but now it's being proposed to be used for MS and helping with this neurodegeneration component to MS, and it's been getting some good results for people. So that's the fourth type of diet that you can consider, the ketogenic style diet. Now, of course, that's a lot of information to digest, and so where to from here? Have a look at our website and click on the link. I've got more detail on there in terms of what those type of diets involve and how they can be applicable to certain people. It's not a one-size-fits-all approach, so have a bit of a read through there. If you've got any further questions, please get in touch with us, because it's a really great area of research, and it does give the power back to you, the patient or the sufferer from MS, because you can take control of your health rather than just relying on drugs and your neurologist to control your symptoms and your lapses there. So there we go, 4 dietary approaches to help manage MS. I hope that's given you a little bit more information and you can take that away or certainly tell someone that you know about it. Thanks very much.